Morning Crossfire, and now it's time for Budeshi. Let's open it up. Contracting processes, fiscal accountability and transparency, and let's follow this money where it's headed. One more time, welcome back our friends from the PPDC, the Public and Private Development Center, who have been with us all of February, who've done some awesome work tracking monies in the health sector. Well, I'm joined, we have from the Federal House of Representatives, he is the representative of the Isen Itesiwaju Kajola Iwajowa Federal Constituency, Oyo State, and Chairman House Committee on Legislative Compliance, Honorable Olashpo Abiodun Adiola. Good morning, sir.
Good morning, Kofi.
Thank you for making it out. We haven't seen your colleagues in a while.
It's been a lot of project work these days.
Indeed. Yeah. Thank you so much for making out the time. We also have Nkem Ilo. She's the Chief Operating Officer of the PPDC. Hi, Nkem.
Hi, Yofi. Good morning.
And we also have Priscilla Ogege, who is the Procurement Monitor and who has all the information. She has provided all the information we'll be discussing today. Good morning, Priscilla.
Good morning, Yofi.
And well done.
Thank you.
Well, we look at, our focus goes to Lagos, Osun, Ogun, and Oyo State. And when I was pre-selling this earlier, I said we're going to the Wild West. But I think it's wild for good reasons. Well, Priscilla, what did you find? And where did you visit? Just give us an idea briefly of where you visited, what you were looking for, and how it went.
Okay. I visited Lagos State, Osun State, Ogun State, and Oyo State. And I went there to monitor these sites based on the procurement data that we have from National Public Healthcare Development Agency. And at Osun State, when I got there, I noticed they had few drugs. They had torn and worn out mattresses. They have mosquito nets on their window, and I was surprised to see a solar fridge there because the place was looking a bit somehow. And they didn't have a signpost, but it was fenced.
Okay.
And then on getting to Ogun State, that's Odo Layaran, they had an old building, no fence, no signpost. It was locked. But I was told that the person that runs the place comes in when there is an issue or when someone needs help from the PHC. And then I went to Agbo, Ijebu. That's Ijebu North. It's very active. It has intact beds. It's neat. It's well kept. And it's a type 2.
Okay.
Yeah, and when I got to Lagos State, Imota PHC, it was very active, very neat. The staffs were very hospitable. It's fenced. It has an ambulance. It's a type 3, and I was able to have an interview with 2 of their patients who spoke very well about the PHCs and how the doctors there took good care of them. Then I went to Aja. From that place, I had to take a speedboat, which was 15 minutes on the sea, and I was very scared. Then at Aja, the PHC was neat, it was active. It's a type 3. It also has an ambulance, and it has water tanks, and is just a little bit in the heart of the market, kind of.
Okay.
Yeah. So, but for Oyo State, that was my difficulty. That was the challenge I had. I was trying to locate the place. I couldn't get the place, and I had to come back. So probably maybe next time we'll be visiting there again.
Okay. Even though your main committee, your main thrust is legislative compliance, but you do represent sizable amount of people.
I'm a member of Committee on Health and so on.
Okay, perfect. So how would you gauge the performance considering the mandate of the healthcare agency juxtaposed against the findings that PPDC has been able to provide?
Yeah, thank you very much. Yeah, I firstly have to commend PPDC for their efforts. I think if we have more of this, we'll be beyond where we are today in terms of healthcare delivery. And the aspect they are actually interested in, that's the primary health care. That's what actually affects the people in the rural area. Like majority of Oyo State, or let me say where I come from, my constituency is almost 100% rural. And we basically rely on primary health center. And I think when next time she's going, I think I'll be very interested if she could contact me. Everywhere on Oyo State is accessible and I'll be easily navigate her. You see, one of the biggest problems from our reports, you discover that our report from Lagos State, you see a lot of interesting stories is coming with compared to Oyo State. One of the biggest problems we're having is that health workers don't want to go to rural area. We have so many of these facilities lying there, equipped. Even nurses don't want to come go to place of doctors. So it's one of our biggest problems. Then this problem cannot be treated in isolation. Because when you see all these primary health centers, you see so many organizations and several organs of government providing them. You have the National Primary Health Center building their own. You have local government authority building their own. You have State Ministry of Health building their own. Then you see legislators in constituency project building their own. And sometimes you'll be amazed the kind of animosity. If, like, I'm a sitting legislator now, to attempt to equip an health center built by my predecessor, especially if the person is not from my party, they'll tell you, no, you can't do it. So there has been no synergy at all within these different levels. So there's the need for coordination. There's a need for coordination to really streamline and get whatever you walk away.
But it doesn't mean that people are getting access to
especially in the rural area. Especially in the rural area. That's the biggest problem we have.
But what do you think? And this issue you just raised, it's as if you've been in all 3 or 4 other meetings we've had with the PPDC every Friday on Budeshi, where this issue of hybridization is really at the fore. What do you think you and your colleagues can do in the National Assembly to pass legislation, insist on certain processes to make sure that it is harmonized?
See, you'll be very surprised that looking through our laws, we have more than enough laws to actually streamline these activities. So basically, where we should look at is actually the supervising ministry. The Ministry of Health, maybe they have so many things doing. The National Primary Health Development Agency, I think they're in the best position. If we look at their law, we look at the act establishing them, I'm sure we're going to get something, that a part of the law that will do this criminalization. And there's none there who could easily insert it because there's need. There's that urgent need. There's that urgent need for us to actually streamline. There was an attempt by the Minister of Health during the 2016 appropriation process that we're going to build one primary health center per ward. And we do a survey. We did a survey to see where they do have, where they don't have. As I'm sitting down there, some wards in my constituency will have up to 3, 4, and none will be functional. So you really think there's a need for us to streamline, and there's a need to apportion, especially in terms of staffing. Most times you see drugs there, you see equipment, you see bed, but you won't see staff. Even in a primary health center like in my local government, you hardly see doctors because nobody wants to come to the rural area. These are just the biggest problem we're facing.
Let me bring in at this point, and like we've always tried to drive this whole narrative to ask why Nigerians should be concerned about this. Well, I don't live in the rural areas. I live in Abuja. Why are you guys yapping on and on and on about primary healthcare centers? Which one has borehole? Which one has ambulance? Which one is completed? Which one is under lock and key? Why does this narrative?
Thank you. And before I answer your question, I'm really glad the Honorable referred to this chaotic processes. Because like now, he said 3 in a ward, and federal government has a plan to build more or revitalize or put one in each senatorial district. What happens to those ones we build? That's a question that needs to be answered at some point. But back to your question around why am I interested? I'm an Edo girl, but I'm married to an Enugu man, and every year we go back to the village. Sometimes the usual mass exodus during Christmas period, And sometimes these villages are so far away from town. Just imagine if you have diarrhea and you need to access healthcare. You won't be driving from one village that is 1 hour away from the city center to get to the city center to get drugs. You'll be going to the nearest health facility closest to you. And that's one of the reasons why us, Abuja people, should care. For information, even in Abuja here, we have a primary healthcare center.
Yeah.
And Priscilla also went to visit it. And it was well equipped. And I told her maybe I would go there and just pretend I want to do something and see what kind of services I will get. It's not about, it's also about the cost of services there. Because if you go to some of these government hospitals like Gariki, the cost may be a bit higher than the average person can afford.
Yeah.
But the primary healthcare centers are built to be able to take care of those basic treatment at a lower cost.
How do you think you in the National Assembly can do something about this local government contributions to primary health care? Because for them it's mainly staffing. How do you think that can be addressed?
Best way to take it is the state's houses of these members, so that they can actually, but the best thing to do is to attack this thing from the state level, especially from the state houses of assembly, to see how we can, even the Federal Ministry of Health, there's little they can do at that level, because it's actually beyond the purview of the
Is it to you, to Nkem, and what the PPDC stands for? Your concern really is to know where these monies go.
I totally agree. Because somebody just made a comment that just captures it for me with regards to your first question. Buildings don't treat people. I heard somewhere, I can't verify this, that 80% of the funding for health comes from contributions, not necessarily appropriation. But the problem, the one thing I wonder about, especially when you're reading a lot of these reports, and the World Bank gives this money, this other agency gives this money, is who supervises how this monies are spent, and what is the sustainability plan? Because we're so quick, eager to take donor funds and implement, but what's the sustainability plan injected into the spending of that money beyond the donor fund? So when the donor has done that 1 year and walked away, and there's this signboard donated or funded by World Bank or some other agency, and they move away.
Good morning.
Hello, good morning.
Welcome to Budeshi.
Yes, thank you.
What's your name?
Hello, Ezugu Virginia.
Hello?
Ngozi.
Ngozi, all right.
My name is Ezugu Virginia.
Oh, okay. Go ahead.
Thank you. I am happy that they've gone around the whole state to find out what actually happens at that community level. Just like the lady said, the maternity community center in my place is called maternity. It's supposed to take
What state is that?
I'm from Nsuka,
Okay.
in Halumon,
Okay.
in Handiago. The community center is at in Handiago,
Okay.
just close to the primary school. It's called Central Primary School, Handiago.
Okay.
Yes, I think the lady from Enugu State should know better. Yes. So it has been there for long, and it's called maternity center. If you get there now, there's nobody there other than one cleaner. She is the person that runs as a nurse in a care center like that, just the cleaner there. And it baffles me why people should build structures and just leave it empty like that. And this has happened a long time ago, even before I was born.
What you can do, because we're going to have to take other calls, but what you can do is if you can get on Twitter and follow PP Monitor NG, PP Monitor NG on Twitter, and then you can interact with PPDC. I will take a 30-second contribution finally from you, and then from Honorable.
Hi Sam, I hope you are listening. Thank you very much for that suggestion. These are kind of suggestions that PPDC is encouraging. People get on Twitter at PP Monitor NG and give suggestions that we can collate and pass across to the relevant authorities. And that community cost, I didn't know about it until you have said it, and I'm sure if somebody says something else, it will make sense. And I'm also thinking, it has also given me the thought of NYC program. Why are we not deploying doctors during this NYC 1 year to those areas? Those are areas we can think about. Please get on Twitter and let us have your thoughts and comments.
Honorable Adiola, your final thoughts.
Yeah, well, actually, what I would say is that there's a need for us as people of Nigeria, as what earlier said, for us to actually change our whole mindset as well. Because you talk about youth corps member being posted to the rural areas or even students. This same youth corps member will meet their parents, will meet their honorable to redeploy them away from them. And if you refuse to do it, they'll say, don't worry, it's coming back to meet us. So it's a holistic thing. And that in terms of constitutional amendment, the National Assembly is doing a lot in terms of local government autonomy. And I think the last scholarship does endeavor to. And it's not easy to amend the constitution. It takes a lot. But we are working generally to make sure that healthcare delivery gets to the rural people.
Well, thank you very much.